Choosing the wrong behavioral health EHR means months of migration pain, staff retraining, and revenue disruption. PIMSY versus Behave Health. It is one of the most consequential decisions an operator can make. The platform you select touches every part of daily operations, from the first inquiry call through documentation, billing, and alumni follow-up. So let us compare the two across admissions, clinical documentation, billing, and operational tools. First, understand that these platforms are designed for different organizations. PIMSY appears to be a practice management EHR serving mid-market mental health, psychiatry, and substance use practices. Behave Health combines CRM, EHR, RCM, and ERP in one system built for facility-based treatment. Mid-market practice EHRs and facility-based all-in-one platforms solve different problems. Get this decision wrong, and the cost is real. Getting it wrong means months of migration pain and staff retraining. It can mean revenue disruption while your team rebuilds workflows on the wrong system. The EHR you pick reaches from intake through clinical documentation, billing, and alumni follow-up. Here is the core difference. Behave Health is designed for the clinical workflows facility-based addiction treatment requires. It is designed to support ASAM criteria assessments for level of care placement and continued stay documentation. It includes COWS and CIWA scoring to help support safe withdrawal management. A patient record created at admissions flows into clinical documentation and billing without duplicate data entry. Let us walk through the 4 areas that separate these platforms: admissions, clinical documentation, billing, and operations. 1. Admissions, the revenue engine of any facility. PIMSY appears to focus on practice management and scheduling more than a dedicated admissions CRM. Behave Health offers online patient applications and instant verification of benefits during the inquiry call, plus lead and referral tracking, census visibility across locations, and alumni tracking after discharge. 2. Clinical documentation, the core of any behavioral health EHR. PIMSY appears to offer progress notes, treatment planning, and assessments geared toward outpatient practice settings. Behave Health adds group therapy notes with attendance, integrated drug testing, bed management, and telehealth, and outcomes tracking with validated instruments like PHQ-9, GAD-7, the CSSRS, and NAATP-FORSE. 3. Revenue cycle management, the difference between sustainable operations and chronic cash flow problems. PIMSY appears to offer claims submission and eligibility verification built for outpatient practice billing. Behave Health integrates RCM into the clinical workflow, so documentation supports billing from the point of care. Eligibility verification, claims, ERA and EOB processing, and denial management with appeal tracking. 4. The biggest difference may be what happens outside the clinical record. Treatment centers manage properties, vehicles for patient transport, maintenance schedules, and staff credentials. Most practice management EHRs, including PIMSY based on public information, do not appear to include these tools. Behave Health adds an ERP layer for property, HR, vehicle, and maintenance management beside the clinical workflow. If you are a current PIMSY user weighing whether to stay or switch, the move is structured. Behave Health provides a migration path that includes transferring your data, plus staff training and parallel go-live support, so the transition does not disrupt operations. Common reasons to switch: expanding into residential or detox, adding recovery housing, or needing operational tools in one platform. So, the bottom line comes down to scope and the kind of organization you run. PIMSY appears built for mid-market mental health, psychiatry, and substance use practices. Behave Health is purpose-built for facility-based treatment, recovery residences, and multi-site operators. Stop guessing which behavioral health EHR fits your organization. See the all-in-one platform in action. Walk through CRM, EHR, RCM, and ERP on real workflows. Book a demo at behavehealth.com.